Yeah, thanks for watching. Let's talk about hydrochlorothiazide, HCTZ. It's a very commonly used drug to treat high blood pressure, and it works pretty well. And the question is high blood pressure a normal part of the aging process? Well, to find out the answer, we have to go to some primitive tribes that don't have any association with the West. Western societies, 50% of the population or more, by the time they're age 50, develop high blood pressure. But if we look at the Kuna Indians, isolated and living off the coast of Panama, when they're 50 and 60 and 70, their blood pressure is the same as it was when they were 20, 30, and 40. Doesn't increase because their diet is low in sodium. They don't eat junk food. They have lots of fruit and vegetables. They don't have any westernization, Western influences. But if those people migrate to Panama City, for instance, in a short period of time, half of them are going to develop high blood pressure. So it seems like high blood pressure is secondary to westernization, to our diet, to the sodium that we consume. Too much sugar. It also appears that the concept of high blood pressure is relatively recent. Franklin Roosevelt, World War II, with a blood pressure on the top number of over 200, bottom number well in excess of 110, was thought to be relatively okay. It wasn't until the first study that was published in 1967, with an emphasis on the bottom number, the diastolic, that showed that if the diastolic number was between 115 and 130, and it was reduced to, say, about 90 or so, we could significantly reduce the likelihood of stroke and heart failure. A second study came out in 1970 that showed that if that bottom number was between 90 and 115, and we reduced it again, benefit as far as the incidence of stroke and heart failure was concerned. And surprisingly, the first study that showed that the top number was important was the Systolic Hypertension in the Elderly program, published in 1991, that showed if the top number was more than 160 and we reduced it, then we would significantly benefit the heart. And that's where hydrochlorothiazide comes in. Hydrochlorothiazide, or HCTZ, most commonly prescribed diuretic. It gets rid of excess fluid, gets rid of the sodium inside the system, and as a result reduces the blood pressure and also reduces the likelihood of congestive heart failure. And if you have fluid buildup from congestive heart failure, it helps that. And if you happen to have kidney stones due to excessive calcium in the urine, well, it prevents excessive calcium in the urine, so it helps reduce the recurrence rate of kidney stones, and in addition, because it reduces the amount of calcium going out, the calcium stays in the bone, so it can help osteoporosis. Used for a variety of other purposes as well, but those are the main ones. It's a water pill. It's used either by itself or more commonly, because we're not paying attention to our diet, we're not reducing the sodium, we're not increasing the fruit and vegetables and the nuts that we consume. We're not doing anything else that's healthy. So as a result, we have to take oftentimes 2 or 3 antihypertensives. Well, the hydrochlorothiazide by itself can help improve shortness of breath if it's due to excessive fluid that builds up in the system. If you have some swelling in the ankles, again, this medicine seems to help because it gets rid of the sodium, and with the sodium goes the water. There's another pill in the family that was actually used for most of those early studies. It was called chlorothalidone, and chlorothalidone is a wonderful drug. It actually lasts a little bit longer in the system than the hydrochlorothiazide, but for some reason hydrochlorothiazide is the one that's most popular nowadays. Hydrochlorothiazide can be used by itself, or it can be used in combination with a variety of other pills. It could be used with an ACE inhibitor, an angiotensin receptor blocker. It can be used with a beta blocker. All of the medicines for high blood pressure can be combined either in one pill or taken as 2 pills with hydrochlorothiazide. Typically, the starting dose in many of the people is just a very low dose, is 12.5 milligrams a day, increased to 25 milligrams. Again, that's a very standard dose. Tend not to use more than about 50 milligrams for the most part. And at the low dose, 12.5 milligrams or 25 milligrams, relatively few side effects. Higher doses, it can be used to treat excessive fluid buildup, maybe from congestive heart failure or cirrhosis of the liver or renal dysfunction. But we tend to use other drugs for that. If you have some swelling because you're pregnant, the swelling because of pregnancy is usually not due to high blood pressure. It's usually due to the big uterus pushing on the vessels that help the blood go from the legs back to the heart. So better treatment than a diuretic would be some support stockings and elevate your legs. If you're taking it because you have kidney stones, it's going to take about a year to become effective. If you take the pill for high blood pressure and you do it as a diuretic, well, it's going to become effective within 2 hours of taking it. It's going to have its peak activity about 4 hours after you take it, and it's only going to last, at least as far as excessive urination is concerned, for 6 to 12 hours. Now, you could take it if you have fluid buildup without having high blood pressure. It sort of works in that regard like aspirin. If you take aspirin and your blood temperature is normal, it's not going to reduce your blood temperature, your body temperature. If you take the hydrochlorothiazide and your blood pressure is normal, it's not probably going to go down. You want to take the pill, for the most part, in the morning. You want to take it in the morning because obviously you don't want to be up all night tinkling. Well, there's question about how long the pill really lasts. And does the pill give you complete 24-hour protection? The half-life is only somewhere between 6 and 12 hours in most people. It's going to be eliminated mostly without change in the urine. But the question is, well, is it as good as the chlorthalidone? Well, at least as far as equal doses are concerned, equivalent doses, yes, it's as good, but remember, the chlorthalidone is going to last a lot longer. The chlorthalidone is going to last for 50 to 60 hours in the system. So you get good nighttime control. And what we're finding nowadays is a lot of people who have hypertension can be controlled adequately in the daytime, but the drugs wear off before the 24 hours. So what we want to do is we want to consider having coverage at night too. Now, if you have high blood pressure and you take the hydrochlorothiazide, how much is your blood pressure going to fall? If you take the low dose, the 12.5 milligrams, it's going to fall by about 4 millimeters. If you take the 25 milligrams, it's going to fall by 8 millimeters. If you take the 50 milligrams, it's going to fall by about 11 millimeters. So that obviously is pretty good. And actually, full dose of any of the antihypertensives is going to work about the same. So it doesn't matter what kind of drug you take, it's going to work about the same. The only difference is, do you have the nighttime control? And that's very important nowadays. And as I said before, many people are going to have to take more than one pill because you're not exercising and you're not cutting down the amount of sodium, you're not looking at what the sodium concentration of your soup is. And most people say, well, geez, I don't add sodium. Well, only about 5 to 10% of all the sodium you get is from using a salt shaker or having the person cooking the food put the salt in it. Most of the salt that you get is from the processed food by itself. So read the can of soup, look at the loaf of bread, look at the nutritional information and see how much sodium is in it. You want to reduce your sodium to no more than about 1,500 milligrams to 2,400 milligrams a day. And as you get older, you want to go more to the lower number. And if you do that, that's going to make your antihypertensive drugs work even better. And as a matter of fact, it may well be that you don't need them. Or if you were taking 2 now, you might only need to take 1. How do the drugs work? Well, this particular drug works by getting rid of the excess sodium and it gets rid of the excess water. And that's how it's used. It could be taken during pregnancy. If you have high blood pressure, it's probably not the first choice. It's excreted in the breast milk, but that's not usually an issue. Has some side effects, and the side effects of taking the drug, for the most part, are not an issue, especially if you're otherwise young and healthy. It can cause some dryness of your throat, some thirst, some weakness, or some lethargy, some drowsiness, but those are relatively unusual. Could cause some muscle cramps or some muscle fatigue or gastrointestinal upset. if you draw some blood tests, you might find that your potassium goes down even more than your sodium. So you might have to take a potassium supplement. Magnesium can go down, but good news is the calcium can go up, and that might mean that your bones are going to be a little stronger. But if you have high triglycerides, the triglycerides do go up some, so that might be an issue. If you have the gout, or a tendency to the gout, the uric acid, the causative agent, that's going to go up a little bit, and your blood sugar will go up a little bit. But again, those aren't major issues. If you happen to be older and you happen not to be drinking enough liquid, well, you could become dehydrated taking the medicine. If you become dehydrated, again, the weakness, the muscle cramps, the irregular heart rate, sometimes confusion. And you could develop what we call orthostatic hypotension. When you stand up, you get a little bit dizzy because all of the blood goes down to your legs and you don't have enough circulating blood. That happens to be extra common if you combine the hydrochlorothiazide with either alcohol or an opioid or sometimes one of those old-fashioned seizure drugs like phenobarbital. Some people who are taking hydrochlorothiazide are going to have to take a potassium supplement. And if you're already taking lithium, you got to be careful because the concentration in your bloodstream of lithium is going to increase. Now, if you're taking the hydrochlorothiazide, the HCTZ, for blood pressure control, and you're taking aspirin or any of its relatives, the non-steroidal anti-inflammatories like ibuprofen, Motrin, if you're taking naproxen, taking any of those medicines, well, they might prevent the hydrochlorothiazide from working. And the same holds true for taking certain cough and cold medicines and even certain weight loss preparations. Question about whether if you're allergic to a sulfa you can safely take this, and the answer is probably yes. There's a very rare association of side effects with both medicines. They're distantly related. How much benefit do we get by taking a hydrochlorothiazide? Well, it all depends on what your risk is. The more your risk is, the more benefit you're going to get. So if we look at people who have their systolic blood pressure over 160, well, we treat 100 people for 4 or 5 years. We're going to prevent 2 or 3 deaths and 2 strokes. That's significant, especially when you consider that this is a very inexpensive drug, costs less than $20 a month. So what's the bottom line? Yeah, we have a lot of fancy medicines available for high blood pressure, but remember, they all work basically the same. Not the mechanism of action, but the amount of blood pressure lowering you get is going to be the same on any of the drugs. And unfortunately, because we don't follow appropriate lifestyle guidelines, we're going to need 1, 2, 3, or 4 medicines to get the blood pressure under control. You're taking the pill to feel better, to get better, to reduce your chance of having a heart attack or a stroke, but you're eating a diet trying to give you high blood pressure and give you the stroke and give you the heart attack. Doesn't make any sense. So blood pressure control, important, no question. If it's over 160 systolic, it needs to be treated. Some people say if it's over 150, 140, should be treated. Now we have the American Heart Association, American College of Cardiology saying, well, if it's over 130, should be treated. But the critical thing is diet, 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 stay away from the salt, get some exercise, lose some weight, and if you do that, well, we're going to find that the blood pressure comes down by itself. If you're taking 2 or 3 drugs, you might only have to take 1 or 2 drugs. And if you're fortunate, we do know that appropriate dietary guidelines will reduce your blood pressure as much as any blood pressure pill will do it. So pay attention. I'm Dr. Ken Landau. Thanks for watching.